We are discussing the mental health, which is defined by WHO as a state of total physical, mental, spiritual well being of a person. Now, whenever we are talking about the mental health, we are basically talking about a person who knows how to cope up with the stresses of life, who knows how to react and to face problems in his or her life, and whatever episodes of psychological variations he's having, whether it is an anxious phase, whether it is a depressive phase, he's going to come out of these phases eventually without any treatments and without any help from the clinical point of view. So if he or she is going to come out of these stresses very efficiently on his own, so he's mentally well and he knows how to be productive towards the community, he knows how to have the relationships within the community. So all of this is basically quite subjective, and again that is why the subjectivity is the problem over here with the mental illnesses and the mental health when we are defining them, because that is why the anti-psychiatric movements have been quite active, and they say that it's quite a subjective point of view whenever we are talking about the psychological point of view to any disease or to any mental illness. So that is the problem over here with the mental illnesses that we have to deal with whenever we are clinically practicing psychiatry. So the mental illness is basically, how do we define the mental illness is again very important. It's not merely the absence of the mental illness, but it's the subjective capability of a person, that how he basically is emotionally and physically responding towards the stresses in his or her life, and how he's basically being protective towards the community. So these are basically the aspects of the mental illnesses that we have to keep in mind whenever we are practicing as a clinical psychiatrist, as a clinical psychologist. And the classifications of the mental illnesses will be discussed over here in this section. Moving on, we'll be discussing the entity and the dimensions that are relating to these mental illnesses. Furthermore, we'll be discussing the effects of the cultural behaviors as well. The culture in any era or topographical, geographical areas, there are a lot of cultures prevailing, and they respond to different mental illnesses quite differently. So we, working as a psychiatrist, one should know how to deal with these cultural aspects of the mental illnesses as well. So defining mental illness, it's basically an illness that causes the disturbances in the thinking, in the perception, and the behavior beyond those that might be experienced even in an acutely distressed state. So being anxious, have a thinking perception that is different and that is quite variant is normal. Because everybody perceives different problems in different ways. But one should know how to basically react to these acutely distressed states. So that is important. And while we are defining a mental illness, this is how we basically reflect or view towards these mental illnesses whenever we are talking about them as a psychiatrist. Then the mental disorders are again very important, and we'll be dealing with them. The mental disorders, they can be some psychomotor phenomena or some psychological eras as well. So there are a lot of classifications to these mental illnesses. We can talk about the ICD-10 as well. So the ICD-10 is another classification, and it's basically an international classification that comes into action whenever we're talking about it. For example, the Axis 1 that deals with the mental health diagnosis. So this Axis 1 is defining how we're going to diagnose if a certain person is suffering from an anxiety disorder or a mood disorder, or is it a split personality disorder, it's a schizophrenic episode. So how do we diagnose? The criteria is quite simple, and it's all documented in that classification over there in the Axis 1. Talking about the Axis 2, it's basically depending upon the developmental anomalies that are going to reflect into the mental illnesses. And then moving on towards the Axis 3, it's basically the intellectual aspect to the mental illnesses. That will be discussed over here in this axis 3. And moving on to the axis 4, it's basically the organic along with the physical behaviorals that are going to reflect upon the certain mental illness. It can be in any chemical phenomena that is ongoing in a body that is reacting towards the mood, towards the anxiety of a person. So then we have the axis 5 over here that is basically dealing with the psychosocial aspect of any mental illness. So if we are in a cultural state in which a certain mental illness has certain aspects towards it, then we're going to deal with them accordingly. Now, talking about another classification that basically includes the F09, that is the organic, including the symptomatic and the mental disorders. So there are a lot of mental disorders that don't have any symptomatic eras towards them. But over here in this F09, we have the mental disorders that include the symptoms as well. F10 is again, F1019 is basically a classification that is dealing with the mental and the behavioral disorders due to the psychoactive substance abuse. So the addicts are basically, they fall into this category, and we're talking about the substance abuse along with the mental illness. How is it paired along with it? Talking about the F2029, it's basically the schizophrenia, the schizotypical, and the delusional disorders that are part of this classification system over here. Now, talking about the F3039, that are basically the mood disorders over here that we're talking about. It can be the mania and the depressive episodes coupled together, or it can be the depression isolatedly, or it can be the mania in an isolation. So whatever it is, these mood disorders are put in this group that is the F3039. Then we have the F4048 that basically includes the neurotic stress related and the somatoform disorders over here. Then we have the F5059 that basically includes the behavioral syndromes associated with the physiological disturbances and the physical factors as well. Moving on to the F6069s, basically the disorders of the adult personality and the behavioral problems as well. The F7079 are basically the mental retardations, and the F8089 are the disorders of the psychological development. Finally, we have the F9099 that basically includes the behavioral and the emotional disorders with the onset usually occurring in the childhood or the adolescence. So it's basically the childhood psychiatry or the adolescent psychiatry related over here in this group. In the axis 1, we talked about the clinical disorders, including the major mental disorders, developmental, as well as the learning disorders along with it. Talking about the axis 2, it's basically the underlying pervasive and the personality conditions and the mental retardations as well. Moving on to the axis 3, it's basically the acute medical conditions as well as the physical disorders. So this is basically how we are moving on in this classification. It's only the clinical disorders, then we have the mental retardations, and then we have the acute medical conditions as well as the physical conditions. Talking about the axis 4, it basically includes the psychosocial and the cultural aspects that are reflecting towards a particular mental illness in a particular way, and the environmental factors contributing to these disorders as well. The axis 5 is basically the global assessment of functioning or children's global assessment scale for children and the adolescents under the age of 18. So whether it's an entity or a dimension, how do we categorize it? The easier definition towards this is basically that one should be in a complete harmony mentally as well as physically as well as spiritually. The recognition of symptoms is again very important. We have to regard these symptoms towards a particular psychological issue, and the psychotic illness is basically a complete entity, and we have to basically admit that a person might be suffering from a psychological disorder. The dimensional approach is that there are a lot of greater flexibilities to it, and it allows for the context and the specific factors to be accounted for. When a problem is a problem, to diagnose this, people may be suffering from anxiety or people may be suffering from panic disorders, but one should know how to deal with these disorders. If he doesn't need any clinical intervention, then he's not suffering from a mental illness. It's just a variant of the behavior in a person. The effects of people's cultural backgrounds is again very important. Different cultures basically think about the mental health and mental health problems in different ways. The developed countries, they react to these mental health problems in different ways. They cope up with the treatments as well, and they make sense of certain symptoms and behaviors as well. The services are chosen to accept in the developed countries, while in the developing countries, these aspects are not looked for in this way. The treatment and management strategies, they are found acceptable in the developed countries, while when we're talking about the underdeveloped countries, they do not basically accept these psychological illnesses or the mental illnesses and do not accept the services as well. So in this section, basically, we dealt with how this mental health is defined, these mental illnesses are defined, and how are they classified in the different categories. That is the end of this section. Thank you for watching sqadia.com.